Hey, good evening, ladies and gentlemen, and welcome to our Choose VA Tele-Town Hall. I'm Chuck Ramey. I'm the Communication and Customer Experience Executive here at VA Southern Nevada, and we want to thank you for coming out to spend a little time with us this evening to learn about VA healthcare and enrollment. So we will go ahead and get started. In the interest of time, we have a couple of our leaders here joining us tonight, and one is our Deputy Director, Ms. Kristen Murray, who's going to provide some remarks here in a second. We also have our Chief of Staff joining us, Dr. Ramu Kamanduri, who is on the line as well. So I want to thank you both for being here. And Ms. Murray, I'm going to turn it over to you for some opening remarks and to get the program started.
Thanks so much, Mr. Ramey. Good evening, everyone, and thank you for joining us today for our VA Veterans Town Hall. My name is Kristen Murray. I am the Deputy Director for VA Southern Nevada Healthcare System, and I'm pleased to welcome you on behalf of the Executive Leadership Team. We appreciate you taking time out of your evening to be with us. Whether you're already enrolled in VA healthcare, considering enrollment, or simply looking to learn more about the benefits and services available to you, we're glad you're here. Tonight's town hall is focused on helping veterans better understand VA healthcare enrollment, eligibility, and the many services available through VA Southern Nevada Healthcare System. We'll also address some common misconceptions about VA healthcare and share information about how veterans can access the care and benefits they've earned through their service. Our goal this evening is to provide clear, helpful information and connect veterans and their families with resources that can support their health and well-being. We encourage you to listen, learn, and take advantage of the information being shared. At this time, it's my pleasure to introduce Ms. Tanya Brown, Enrollment Section Chief, who will lead today's discussion and walk us through the enrollment process, eligibility requirements, and many of the benefits available through VA healthcare. Ms. Brown, thank you again for being here. I'll turn it over to you to begin the program.
Okay, thank you. Thank you for having me. As she stated, my name is Tanya Brown. I am the the inpatient enrollment chief for the enrollment department. And again, I'm glad to have you all here for this veteran virtual town hall meeting. So I want to say welcome. So today I just want to talk about the possibilities, the questions that you may have, that everyone may have about the process of enrollment and what that we offer and what help that we can do. So welcome to the healthcare, VA healthcare. No one knows veteran better. Enroll today for high quality, veteran specific care. Get regular checkups, specialty visits, cardiology, for example, podiatry, mental health, home health, geriatrics for the elder care, care in the community, urgent care access at over 3,000 plus locations and more, access prescriptions, prosthetics, and medical equipment, all benefits you have earned. Okay, we have quite a few locations. The main hospital is where I'm located at, is 6900 North Pecos. That is the North Las Vegas VA Medical Center. The emergency room is here on the main hospital. We also have Northwest Las Vegas VA Clinic. That is 3968 North Rancho Drive, Las Vegas, Nevada, 89130. We also have the Master Chief Petty Officer Jesse Dean VA Clinic that is located in Laughlin at 3650 South Point Circle, Building D, Suite 200, Laughlin, Nevada, 89029. We also have Pahrump VA Clinic, 220 South Lola Lane, Pahrump, Nevada, 89048. And then we have the Northeast Las Vegas VA Clinic, Community Resource and Referral Center, which is 4461 East Charleston Boulevard, Las Vegas, Nevada, 89104. And then we also have the Southeast Las Vegas VA Clinic at 1020 South Boulder Highway, Henderson, Nevada, 89015. And at all these locations, you can come and get yourself any question that you may have, or get yourself enrolled about the enrollment eligibility process. Okay. You can come here and get your VHIT cards as well. We also help out with if you're requesting your DD-214 or anything in that nature. Sorry. Okay, so additional clinic location, we have the Southwest Las Vegas VA Clinic, 7235 South Boulevard, Buffalo Drive, Las Vegas, Nevada, 89113. And then West Cheyenne VA Clinic is 3525 West Cheyenne Avenue, Suite 106, North Las Vegas, Nevada, 89032. So I'm going to go over the myth versus facts, the debunking enrollment myth. So the myth is I didn't serve in the combat. I wasn't an injury in the service, so I'm not eligible for VA health care. The fact check is if you served in the military, even during peacetime, in the military, in the active military, naval, or air service, and are separated under any condition other than dishonorable, you may qualify for VA health care. Okay. One more myth. I do not want to go to the VA because I want to save those appointments for those who really need them. I hear this a lot. Fact check. We receive funding based on the number of veterans who use our services. So don't be scared to come in. It's okay. By choosing VA for your care, you're not taking away from others. You are helping expand access for every veteran, meaning that's putting money back into our facility to help us to gain more footing for other veterans. Okay, myth number 3. I want to go to the VA, but I do not want to lose my private health insurance. Assuming you are eligible for VA health care, you do not need to give up your private health insurance. And I repeat that, you do not have to give up your private health insurance. You can keep your private insurance and VA health care too, the best of both worlds. Myth number 4. I make too much money, so I have never applied for the VA care. Fact check. Eligibility isn't just about income. There are many other factors taken into consideration when applying for VA healthcare, including service-related conditions, time and location of service, and more. And that goes back to some of our veterans. I mean, that goes to, according to our veterans, that is in an 8G status. Just because you're in an 8G status, that does not mean anything. We can look into it, send up a health alert and health and eligibility alert to see if you qualify for any other type of factors out there. Because we do have the terror and other things like that that will help these veterans that does make too much money, okay? And so myth number 5, I have a service-connected rating or a disability rating through the VA. So I am already enrolled in the VA healthcare. Fact check. Disability benefits don't automatically enroll you. You must still apply for VA healthcare. The good news is that a service-connected disability is a qualifying eligibility factor. And so when you do get service connected, it's a possibility you did not get enrolled if you did not come in first to get enrolled. Or you may not have been eligible at the time before you got the service connection. So you're in this registration status. So it's good to come on in to get enrolled so you can utilize the health benefits. Okay. So choosing a VA means you get everything you need in one spot. VA comprehensive healthcare services can improve your health and well-being while saving you thousands of dollars per year. Even if you don't need this care today, you may need it tomorrow or the next day or 20 years from now. And once you're in, you have access for life. Come see why 93.6% of patients said they trust VA for their health care. Okay. It says, what could VA healthcare means for you? Okay, let's see. So comprehensive healthcare from preventative to specialty care, no insurance needed. What your doctor recommends is what you get. Vision and healthcare, exams, glasses, contacts, and hearing aids for eligible veterans, and mental and whole health, support for your mind and overall well-being. And they have so many different programs for the whole health.
Tanya, do you want to take a question right now? Someone is asking, how do they know they have been approved or that they receive disability, like a disability rating?
Well, typically, the VBA will send out a letter to let them know once they approve. And sometimes, once you get approved for your service connection, sometimes you would get the money before you get the letter into your account, the account that you provided. But it's typically a letter that you get in the mail letting you know that you approve. It's a lengthy process, but yes, once you approve, you get that letter from the VBA.
Yeah. Yeah. Hey, Tanya, it's Chuck. I think what they're asking is how do we know at VHA when we enroll them in healthcare that they have a service connection, particularly when we're setting them up for care or setting up their priority group and that. I think that may be more what the veteran was asking.
Because sometimes when they was in service, sometimes that's been already implemented and party was already in process. So sometimes it carries over into when they first get enrolled. So sometimes they already come service connected due to issues that had happened already prior. So we'll know automatically just based off that factor alone and also income wise that bring up the priority group or where they lie in. So it depends on what type of priority group they'll go into.
Latoya Clark put in another question. She said, my landlord already knew, but I didn't. If you log on to va.gov, you can log into My Healthy Vet and you can see all of that information there. So va.gov, if you don't have a log on for va.gov, I would suggest getting one because that's where you'll see all of your records and all of your ratings and everything,
That's
other than a
correct.
letter. Yep.
Okay, any more questions about that? So yeah, so typically once you get enrolled, you automatically be placed in the priority group, either one, priority group two, priority group three, priority group four, and then we have five, six, and seven, and then also eight. And each priority group has their meaning. I don't know if we have time. I can go through them real quick. Lucretia, do we have time?
Yes, your show, Tanya.
Okay. So for the priority group one, service connection, service connected for 50% or more, unemployable due to service connection conditions and medal and honor. Priority group two is service connected 30% or 40%. Priority group three is service connected 10% or 20%. Prisoner of war, you can be Purple Heart Medal, discharged for disability incurred or abrogated in the line of duty, and receiving disability compensation. And priority group four is catastrophically disabled, receiving aid and attendant or housebound benefits. And then we have priority group five, receiving VA pension, eligible for Medicaid, non-service connected NSC, or non-commensable is 0%, and service connect with income below means test threshold. And so we have priority group six is commensable 0%, exposure to ionizing radiation during atmosphere testing or during occupation of Hiroshima or Nagasaki, if I pronounced that right, sorry. Project 112 Shade, Camp Lagoon, Republic of Vietnam, Persian Gulf War, Theater of Combat Operation. And then we have priority group seven. That one is it goes into the income threshold. You have to agree to the copayment, and the income below the geographic means test threshold for their resident location. And then priority group eight, you agree to the copayment as well. And this one is when you're above the means test threshold and the geographic means test threshold. Sub-priority group is 8A, 8B, 8C, 8D, and 8E, and 8G. Any questions with that one?
Do you have that written out, Tanya? And I can put it in the chat.
No, I don't.
Oh,
No,
okay.
I don't.
That's okay. We can send it out later.
Yeah, I can send it out. I got copies of it.
Yeah. Yeah, and I think, hey, Tanya, one thing that is of interest is when a veteran does come in and enroll in healthcare, and we their priority group is determined, do you guys still send out kind of a personalized guide to them to show them what their entitlements are as part of their priority group? That also includes like, hey, if you're in this priority group, you may incur a copay, and here's what it is, and those types of things. Do you still do that in enrollment?
So what we do that's why it takes us a lengthy process when we have our veterans to come in to enroll. We go over everything with them right then and there. HEC normally send out the letter once we do this process. They send out the eligibility letter or the denial letter, letting them know which one, whether they eligible or deny, not eligible. But when they eligible, we know right then and there, as long as the application is completed and everything, and we go over everything with them. And what is their next step? So if they needed to put in claims that they were having some issues while they were in service or develop anything after service, we also let them know that it would be feasible for them to go ahead and put in a disability claim and start a process with the VBA. So we typically go over everything with them, but no, we give them all. We have a lot of different pamphlets and information that we have. We tend to give that information to them at the time of enrollment, and we go over that information with them as well.
I switched the slide for you.
Okay. I was like, wait a minute, what slide is that? Okay. Any more questions before I move forward? Okay. So what could a VA healthcare means for you? Travel reimbursement. Eligible veterans get paid for miles to and from scheduled appointments. So when it comes to travel, this is when, so let me start with you're not required to do means tests every year like it used to be, only for certain benefits, certain programs, and travel is one of them. So every year you will have to do a means test if you were inquiring about the travel reimbursement or the travel transportation. So that's one of the programs that require for you to do a means test. Um, and then easy check-in, no forms, just your VA ID. Community care, be seen in your community if VA care is too far or not available. And dental care, available for those who qualify. Okay, learn if you are eligible for VA care. Your service matter. So does your health. Um, if you serve in the active military or reserves or National Guard, called to active duty by the federal order by the Title 10, and completed service, even during peacetime, you may qualify for VA care. What you all need to enroll before you start VA healthcare application, have these ready. Your discharge papers, which is your DD 214, your most recent tax return, your social security numbers if you and your dependents, insurance card details if applicable, and also a state ID or a driver's license as well. So it's so many ways now that you can enroll, which is a wonderful thing. So if you in private in your home, you can actually use your laptop or computer and enroll online. Okay, so you can get a peace of mind to enroll today. You can apply online, you can apply by phone, or you can apply in person at one of the locations that I said prior to this early on. And also you can apply by mail. We also here at our location, we have set up a way that we do the My Healthy Vet. And if you have an account with My Healthy Vet, you also, even if you have questions, you can submit those questions to My Healthy Vet and also submit any type of paperwork that you would like for us to go over as well.
Hey, Tanya, before we move on, just one quick question. I noticed we didn't have the clinic details on our slides there. When we're talking about apply in person. You can apply in person in our healthcare system here at the main VA Medical Center or at
Mhm.
any one of our community clinics. That's correct, right?
That is correct. And all the clinics that I named earlier, you can definitely go to all of those clinics, even the one in Laughlin. But the main hospital is definitely at 6900 North Pecos. Okay. After you apply, you'll be notified within a week. Typically, it depends. Um, typically, with HEC, you will be notified with the welcome letter and the confirmation letter. Um, but we typically give that information to you right then and there, unless it's something that we need to verify. Okay, I just want to put that out there first. Um, but here's what you expect after you apply for VA care. Within a week, you will get a welcome call to schedule your first appointment and ask questions. No waiting, no wondering. So when you come to our facility, and we got the documentation and everything that we need, once we enroll you, we know right then and there. And we also get you scheduled right then and there for your first primary care appointment. Okay. Confirmation letter with details on your next step. On the VA benefit handbook that explains coverage, copays, and priority group. And we also have those books here in our facility. So that's some of the information that we was talking about, Charles, Mr. Ramey was talking about, that we have that information here. And we also give that information to you at the time of enrollment.
Latoya says she has everything to get enrolled. However, when she went to get her photo taken, she didn't get her photo taken. So that's the problem. When can they come in to get their photo taken for a veteran's ID card?
They can come in Monday through Friday. We typically open up at 7:30. Our last veteran that we take in is at 3:30. We allow 30 minutes for processing, and for scanning and stuff like that. But you said that she already enrolled, if what I heard, right?
She says she has everything to get
Okay.
enrolled.
Okay, good, good, good. So she has everything. All she had to do is come on down, or you can go online with your paperwork, and then once you get everything settled and it got approved, we can go ahead and take the ID right then and there. And that's one another the steps that we do once we get approval. We try to do everything one-stop shop. Questions. We're here for you. Meaning we love what we do, and this is what we love to do, is to get you here, get you put in the system so you receive the benefits that you are entitled to. So we have the QR code, the va.gov, get started here, request military service records. We also help with that as well, just want to say that. Access and manage VA benefits and healthcare. VA welcome kit. The new anybody that's new to the VA, start here for overview of the benefits, even if you're not. You can also go there and get that information. There might be some information that's be very valuable for you. And the last QR code is the VA Health and Benefit app. Manage your VA healthcare and benefits, payments, and more.
Another thing that I put in the chat, some of you may have dialed in and you can't see the chat, or you don't have easy access to the chat. If you send an email to VHALASPAO mailbox at va.gov, send an email there with your questions. We'll respond to you. That goes directly to us. And then I can also send you the slides if you want them, if for some reason you can't see them. So VHALASPAO mailbox at va.gov is our email.
Excellent. And Tanya, one quick question for you, just so the question that came up about the photo is a really good one.
Mhm.
So I think we can explain a little bit about the ID process. You can get your photo either here at any of those places where you can do enrollment. And I just want people to understand we don't print out the ID cards on site and kind of how that process works.
Oh, no, no, no. That's the process. So once you come in, because they have to go through the MPI system. Um, so once you come in, we get your information. We utilize your driver's license. You can have a driver's license, state ID, or your passport. So to put you in the system to take the picture. And once to take the picture, it takes about 7 days for you before you can get it in the mail. Okay. So no, we don't print ID cards here, unfortunately. Um, So it has to go through another process to get you verified. And yes, you can go to any of the locations to take a picture. I think our prompt location also take pictures as well. They just do not do any enrollments,
Excellent.
but they will take your application. I will say that. So if you ever wanted to drop your application off with all the important information, that application gets sent over to us for us to process it.
Outstanding. I think one of the things that a lot of our veterans are unaware of is uh, one is like if we talk about that other insurance that we have there when we collect that information. I think in a lot of cases when there are copays involved, if you're doing a non-service connected, there's never a copay for a service connected item too. I think we want to point that out to you. So if you have a service connected item that you are being seen at the VA for care, that is there is no copay for that if it's documented service connected condition. If we are seeing you for a non-service connected condition and there is some sort of copay based on your priority group involved with that care, having your other insurance on hand can avoid you getting a copay from the VA as well. So just wanted to make sure you were aware of that. And then
That is correct.
also with your service connection, either 0% or from 0% to 100%, you have access to some other benefits too, such as you'll have to register with them, and they each have different processes, but you might be able to access like the military base for any any commissary benefits or exchange benefits, MWR benefits. Sometimes that card kind of helps you with that. You still kind of have to register with the different sites in that. One other great thing that we have in our community here is we have a partnership with Nellis Air Force Base, the Michael Callahan Military Medical Center over at Nellis Air Force Base, and we try to share resources with them. So sometimes if VA does not have a specific service, there are times, or if we don't have we need a higher level of inpatient care. They are our partners, joint partners, and we can sometimes work together with the military to help you with care and services as well. And then
That is good.
if we can't do either, we also have a community care program where we work with that. And I think the one thing that's interesting about the VA, and it's a benefit of being an enrollee, where you probably don't get in any other healthcare in this nation. And if you've lived in Nevada for a minute, Nevada is a healthcare desert in addition to being a real desert. And, we have standards of care. So, if we cannot deliver care at the VA, or we don't have a particular service, or you have to drive a particular distance, or there's a certain amount of days, then the veteran pretty much gets put in control of how they want their health care delivered. So you qualify for access to community care after 20 days for primary care and mental health if we can't get you in for an established primary care or mental health appointment if you're an established veteran, or 28 days for specialty care. That doesn't mean you're going to get in any earlier in the community, but what that does, it means you have options. But I will tell you, in many cases, the VA, even with those options, maybe having to go beyond those standards sometimes, as we're in a healthcare desert, still may get you in sooner than the outside care. And then they talked about at the beginning, we also have the integrated healthcare with, we look at all your health, wellness, and we have a wonderful whole health program with physical, mental, spiritual wellness all combined there, and some holistic care and services too. And we do things like auricular acupuncture. We have chiropractors, all kinds of great things that are going on. I get my care at VA, and they do a phenomenal job. So I just wanted to let you guys know about that too.
Really,
Yes.
really quick, Tim has a question. He says, is there a copay for Medicare?
A copay for Medicare. So keep in mind we're not an insurance. We are just a health benefits. But we do require you all to have a copay with different priority groups, as I stated earlier. But Medicare is a little bit different when it comes to what we offer here. So you may have a copay with your Medicare, but we don't. We accept your insurance just to have, like Mr. Ramey said, just in case it was something that we couldn't cover, and we'll have your information on file. So when you do go out or get something in the community, that could be a backup or any type of services that we may not have. But if you have Medicare, you may have a copay.
Yeah, and that's a good question. I think a lot of people get that question sometimes. So basically, the federal government can't be insure another, you can't use one federal government insurance to insure another federal government insurance. So if you're getting an episode of care, you're either doing it through Medicare or you're doing it through VA. You're normally, in most cases, not doing it through both, and one doesn't cover a copay for another. So there are chances, depending on your priority group, that you could get a copay for a care and service that may not be service connected, if Medicare is your only other insurance.
And I hope I was able to answer that question clear too. Welcome. Oh, and also I wanted to touch on the commensable with Mr. Ramey was speaking about the 0%. When you tap into being put into a 0%, and you can have 0% for quite a few conditions. The doctor is only required to service you for those 0%, and that's it. But that goes to go a little bit deeper, depending on your situation, um, when it comes to your eligibility. But typically, when you're in 0%, because you could be 0% of your shoulder. And so that doctor will only be able to see you for that particular thing, depending on your eligibility status, though. So these are the ones that's non non-service connected or didn't serve more than 24, but then was eligible, or they may had a bad character discharge or something. And when they come into that and then experience or injury or something in the service, the VBA and nationally awarded them to be 0%. So the provider will be able to see you for that 0%, but that's it.
One other thing I think it might be interesting to point out to you too is, we talk about mental health a lot, and we have phenomenal mental health care and services at the VA. And one of our biggest, our number one clinical priority is suicide prevention here at VA. And one veteran taking their own life is one too many. Unfortunately, we see several more veterans who have found themselves in crisis, and we want to make sure that we connect them with care and services before that comes. So as you hear about some of these different percentages, or you think you're not eligible, if you're a veteran, and you served, if you're in a crisis situation, there are some different rules that roll around that. We would just ask that you, if you ever find yourself in crisis, please go to the nearest emergency room right away and let them know you're a veteran, and we can sort that out after those things. The other things we do in the VA that you'll find no other healthcare system, it is, like we said, we don't want veterans to get in crisis. We have wraparound services. We have phenomenal social workers that will help with all kinds of things. We have a wonderful homeless team here that will go above and beyond to make sure that we try to connect our veterans who might be at risk of homelessness, do their best to make sure that they get connected to some housing however they can, working with the community or within VA channels. So we have that as well. We also have a phenomenal caregiver support program where resources are available for people who are caregivers to veterans. There are two different types of programs with that. One is a caregiver stipend for people that take care of veterans. And then the veterans, there's certain criteria with that. A veteran has to be 70% service connected, and it's based on their activities of daily living and then the caregiver's ability to provide the services they need. There's a whole evaluation process, but anybody who's a caregiver for a veteran can also just come in and talk to our caregiver team about some of the different resources that we offer, such as respite and just support services and things like that as well. So those are some great things that you find at VA. To include, we have a healthy teaching kitchen where we teach people how to cook and and live healthy lifestyles and that as well.
Yeah. And we also have that every month, I would say the third day of the month of each month, we have new veteran orientation, and they will go through all the different programs and all the services that we do have. Lucretia, I think we can probably put that information later, send it out later that we have. Even if you not new and if you wanted to join, it's once a month. And I think it would be a great idea so you all know all the different programs that we do have, services that we do have that Mr. Ramey was speaking upon, so you all can get a clear understanding of all the stuff that we do have here. I also wanted to point out another perk that we do have, a new thing that I think it would be great. Like, say, for an example, you out somewhere and you maybe in another state and it's an emergency. You had to go to the emergency room. As long as you give us a call, you have 72 hours to call the community care, and it's a number that we can probably provide for you all. 702-791-9066, and the option is press 2. Just in case you out in the community or you somewhere not close to a VA and you have to go to another community hospital. As long as you can give us 72 hours, everything will be taken care of from there. You can have, if it's like where, for an example, you are not able to speak or call, you can have your spouse, your relative, your caregiver to notify us as well. As long as they have your full name, your full social, the name of the hospital or ER you went to, the date you went to the hospital or an emergency room, and the date you were discharged, and what ambulance company you use and date you use. Okay. So long as you notify us and within that time frame, you should be good to go.
Nicole has a question. Nicole said, if interested in doing caregiver services, which location gets you signed up?
Mr. Raymond, I know you touched bases on that, but you can go to any of the facilities. I think you can get in touch with the PAC the PAC social worker of that veteran to get signed up.
Yes, they can assist you at one of the clinics, the social workers, and then we do have the caregiver support office here at the main hospital too, that they can assist you to and answer those questions for you as well.
Checking my email to see if anybody else sent an email with questions. I'm not seeing any right now.
All right, so I think Tanya, I really appreciate you spending the evening with us. Tanya oversees our enrollment team here at VA Southern Nevada, and she and her team just do a phenomenal job of making sure that we help our veterans get enrolled in the healthcare system here locally and take care of those needs. And they're always down here, either here or out at the sites of care to answer any questions that you have about enrollment. Yeah, so I think we've provided you the information. I think in the QR codes, we're happy to send you the slides if you want them. But yeah, I think the next steps are if you are interested in accessing your VA benefits, to check those QR codes out there and maybe come visit us at one of our enrollment areas, so we can assist you with that. But you could actually get started online too, as we said early in the session here with the original QR code. You can actually fill out your application online, so that's great there. And then as Lucretia talked about, getting a va.gov account and you have to validate yourself through I think it's id.me and or login.gov. There's a couple of different ones out there, yeah, so that you have a two-party authentication. But once you're in there as well, you can get access to that VA Health and Benefits app. And that's just a phenomenal tool to have, because you can get on there, you can order your medications, you can request appointments, you can get your benefits letters, you can see your benefits payments. There's all kinds of things you can do with that Health and Benefits app, and they always are adding new things every day. So just another great resource that VA offers its veterans.
Yes. So many different ways nowadays. And also, I do want to point out, I may have forgotten to add, as far as the VHIC ID cards, they can be done online as well. You just make sure your background is clear, no glasses, no hat. Same thing that we ask of you when you come in and do your VHIC card here or at one of our locations. And make sure you upload your picture into the system, and also your identification. And we can process, HEC can process, and we can also process it from here as well. So you have an options. If I suggest, if you have a camera's not working pretty good, or you having issues, so it won't be a holdup, I suggest to come down and come into one of our facilities to do the ID card. But if you can't, that it will be a great option for you to do it online.
Righty. Well, we don't see any more questions in the chat, but if you have some, you're welcome to drop them in there or send them to our mailboxes, as Lucretia said before we log off here. But before we do, we did get a question here. So question was separated from the Navy, active duty in July 2011, was in the reserves for a year and a half after, but never remember the exact dates. Will I have any hiccups applying for VA healthcare? Because I separated so long ago. Tanya, when veterans come in and it's been a minute since they served, how can we assist them with that?
Well, I suggest if you do not have your DD-214, we can look that information up. But it is helpful if you can bring in your DD-214. That way we can verify you completely. It looks like you did something. Okay, you do have your DD-214. Okay, that'd be amazing. So yeah, whenever you're available, please come by and we can look over that information for you, and get you going and get you put in the system.
Outstanding. Thank you, Tanya.
Mm-hmm.
All right. Well, so we are not seeing any other questions. So I wanted to give Ms. Murray and Dr. Commodore an opportunity as our executives here at the VA healthcare system. If they wanted to say anything else to you before we sign out for today. Ms. Murray?
Hey, Chuck, I can say a couple of things if
Yes,
you have
that'd be great.
Okay, great. Thank you. First, I think the question was regarding, how late can you enroll? I can tell you a personal story. My brother-in-law was able to enroll his 95-year-old Korean War veteran dad in the VA system, and so he did not enroll till the age of 95. So you certainly can enroll at any time. It's never too late, so that's important. But the other thing I want to tell you is folks that are enrolled in the VA tend to have much better outcomes when it comes to health care. They tend to be in a better, healthier state. Many of their preventable diseases can be better managed because VA does a great job of coordinating. So I will tell you the outcomes are much better. And a veteran who's getting care in the VA has much lower risk of suicide. And as we talked about, suicide is a very high risk factor. It's twice the rate compared to the general public in the veteran population. So it's very important. Enrollment is in serving and participating in the VA system actually reduces that risk dramatically. So that's important. So what we want to say is get more veterans enrolled as possible. We have, if you can share this information with as many friends as possible, any veterans you know, please, because we do want to get more veterans connected to the VA system. And thank you for signing up, and thank you for using the VA.
We got some questions in here, Tanya. Matthew, who was asking about the fact that he separated so long ago, if he'll have trouble. He has his DD 214. Does he need to come in, or can he just enroll online?
I will say come on down so you can see everything and so we can go over everything. More of a personal thing. We can sit down with you and talk with you about everything. I mean, you have an option. You don't have to, but if you want to get more information, we can go over everything with you and live with a person. So you don't need to make an appointment. You could just come in. When you come in at all our facilities, you just put in for enrollment. The volunteers at the front can help you with that. And then you just get the number. We will start with an E and then plus a number, and we'll just call you from there. It's a lengthy process though, but you can do it online, but it'd be best for you to come on in.
And Tim, no, you do not need an appointment. Just come on in. You answered both questions.
You're welcome.
Thanks. I'm gonna just check back in to see if Miss Murray has any comments.
Thank you, Mr. Ramey. Only comment I have is I really appreciate everybody's attentiveness and willingness to ask the questions on this call today. Thank you again, Ms. Brown, for providing the information, Mr. Ramey and Ms. Cunningham for getting everything scheduled, Dr. K for being here also, as well as any other leaders that are on the call. Thanks so much, everybody, for your time and attention.
And thank you, Miss Murray, for your time as well, and then joining us to represent the healthcare system as our deputy director, and what you do every day, and representing us tonight. All right.
Okay.
Well,
I want to say thank you, Mr. Ramey, Mrs. Cunningham, for putting this together and for having me as well. I appreciate that.
Alrighty, well, thanks so much. And then I think, as Ms. Cunningham said, she's given you our email address, and it's actually there on the screen too. So if you have any further questions, please feel free to send us an email to that email address there, and we will be happy to do that. We'll also be happy to send you a copy of the slides as well. And definitely, if you feel like you forgot something, or you can't get a copy of the slides, or you're on the phone, just come by and see us. Like Tanya said, come visit us at any one of our sites of care here in the Las Vegas Valley or within the Southern Nevada. As we talked about, we have the medical center and 6 other community care clinics that are out in Pahrump, Laughlin, and here in the Las Vegas Valley. So just come by and see us, and we will be happy to answer your questions and assist you as needed. And hopefully you will choose VA, and we will see you around the halls, and we're able to say hi to you as you come in and get your care and services. So just would like to thank you for being here tonight. Lucretia, is there anything else that you wanted to add?
Nothing other than our mailbox is always open. Not just today, but every day. VHALASPAO mailbox at va.gov. VHALASPAO mailbox at va.gov, and we respond to those regularly. So that's all. So we're here and we can answer questions anytime.
Excellent. Thanks so much. And thank you. Ms. Cunningham was our lead on putting together tonight's event and coordinating everything. So I greatly appreciate all her efforts on that. So I think without any further questions, we will we'll check our mailbox and that, and we will go ahead and end tonight's session, but look forward to seeing you here at VA in the near future. Thank you for your time.
Thank you, everybody.
Thank you. Thank you for you all for your service.